Hello, my name is Cynthia Okoje. This is a presentation and a case study of Miss Lara Gonzalez. Miss Lara Gonzalez is a 51-year-old female who is divorced and is a freelance journalist. She presents with complaints of flea infestation, but no corroborating evidence was found after a skin examination. Miss Lara said she felt unsafe at home as a result of flea infestation. History of present condition. Her concerns began around 1 week prior to her presentation to the clinic. Specifically, it began in the setting of her sister's diagnosis of invasive cancer, the onset of her own menopause, financial strain that was likely forcing her to move from the United States back to Argentina, where she's from, and a recent breakup with her boyfriend. Psychological and medical history. Ms. Gonzalez had depression once in the past and was briefly treated with an antidepressant. She has no relevant medical problems. She described herself as an obsessive person who had always had contamination phobias, which worsened during times of anxiety. Family history. No one in the family had a history of psychiatric illness. As far as substance abuse history, she denies alcohol or drug use, and her toxicology data was normal. Mental status examination. Ms. Gonzalez was calm and easily engaged, with normal relatedness and eye contact. Her speech had an urgent quality to it. Mood and affect. She described her mood as sad right now. She was tearful intermittently, but otherwise smiling reactively. Thought process and content. Her thoughts were overly inclusive and intensely focused on fleas. She was not suicidal or homicidal. She expressed an unshakable belief that lint was lava and that she was infested. She denied hallucinations. Cognition was intact. Her insight was impaired, but her judgment was deemed reasonably appropriate. Diagnosis. Ms. Gonzalez's delusions with swift return to full prematic functioning suggest the diagnosis of brief psychotic disorder with a number of stresses. According to DSM-5, brief psychotic disorder constitutes of a brief psychotic episodes with a duration of less than 1 month with full recovery to pre-morbid status and a possibility of future relapses. According to the case study, worry about fleas, which is considered a psychotic episode, began after experiencing negative stressors such as her sister's diagnosis with invasive cancer, recent breakup with her boyfriend, and onset of menopause and financial strain. It also indicated that Ms. Gonzalez's preoccupation improved within days and resolved entirely within 2 weeks. However, there is a need for a differential diagnosis to be done since the signs could be an early manifestation of another disorder with a psychotic component. During admission, Ms. Gonzalez was diagnosed with unspecified psychotic disorder. This means psychosis was present, but the condition could not yet be specified. Brief psychotic disorder was only diagnosed after establishing the brief psychotic episode's duration, after establishing that the brief psychotic episode's duration were less than 1 month, as she quickly and fully recovered to premorbid status. Consequently, Ms. Gonzalez's signs may suggest a delusional disorder. According to DSM-5, diagnosis with delusional disorder implies that delusions are non-bizarre and involve situations which could occur in real life. Her preoccupation with fleas is a situation that could occur in real life. However, delusion disorder is characterized by at least 1 month of delusions without other psychotic symptoms. This patient's symptoms resolve very quickly for this condition to meet criteria for delusional disorder diagnosis, hence the diagnosis of brief psychotic disorder. Prognosis. In a meta-analysis conducted by Fusa-Poli et al., it was found that no prognostic differences between acute and transient psychotic disorder, brief and limited intermittent psychotic symptoms, and brief psychotic symptoms and brief psychotic disorder. So essentially, there was no prognostic difference found in all these disorders. Positive prognostic indicators for brief psychotic disorder include absence of genetically related individuals with brief psychotic disorder or schizophrenia, presence of stressful triggers, sudden symptom onset, and short duration of symptoms. In Ms. Gonzalez's case, she meets this criteria as there is no family history of psychiatric illness, negative stressors like financial strains, and her symptom duration were short as they quickly disappeared. Treatment plan. Treatment plan involves both pharmacotherapy and psychotherapy. Antipsychotics, especially second generation antipsychotics, are beneficial or first line in the treatment of brief psychotic disorder. Psychotherapy is necessary to manage stresses, improve coping skills, and minimize recurrence of the disorder. Second generation drugs include aripiprazole, olanzapine, Seroquel, and clozapine. Even though brief psychotic disorder, like the case of Lara Gonzalez, shows complete resolution of symptoms within 1 month of symptom onset, it is recommended that treatment with antipsychotics should continue for 1 to 3 months after remission of symptoms. In first-line treatment of brief psychotic disorder, oral formulations are preferable, but intramuscular formulation can be used in patients during immediate assessment and treatment, especially in emergency settings. Psychotherapy entails informing the patient and her family about the condition and treatment modalities employed on her. Cognitive behavior therapy, CBT, should be considered in this case as it has been shown to be effective even in patients that do not want to take antipsychotic medication. It has been found to be effective in treatment of resistant delusions, where therapists together with patients examine the basis and likelihood of delusional belief, explore alternative explanations, and identify behavior that can reduce the stress associated with the symptoms of brief psychotic disorder. In this case, it will help Ms. Gonzalez adapt better to stressful events that trigger delusional thoughts, such as fleas infestation, and also prevent recurrence of brief psychotic disorder or depression. And here are the references used in this case study. Thank you so much for listening.